The student teaching course when I did it was 18 months, and that was in association with the Northern Polytechnic in London, which was in Camden Town, and they organised the teaching side of it, and then the hospital organised the medical side of it. As part of my student teaching, I had to do a lot more anatomy, and we had to do dissection, which as a student I'd only actually gone to see dissections that other people had done. But there were two of us at the London Hospital doing the student teacher course, and so we were given our own body, which we had half each to dissect. And every morning we would go across to the medical school, to the morgue, and unveil our body and do our dissection. And so we worked down from the shoulder joint down to the hand, and then from the hip joint down to the foot. And I don't know whether it gave me a better appreciation of anatomy than I'd already had, but it certainly did cement a lot of the muscle. I could still reel off the attachments and insertions of muscles even now, and so I guess it did something. The other part of that which I got involved in with the medical school was actually ergometry, where they, in those days, were starting to insert needles into muscles and then get the patient to move and see which muscles were twitching. And that was very innovative, and actually a very wonderful sort of use of physiotherapy, because I could analyse the movements the people were doing in what I thought the muscle work was, and then we could look at the screen and see whether it was actually true or not. So that was what I felt was a very important part of my student teaching days. The other part was I'd always been interested in cardiorespiratory, and at that time at the London Hospital, Sir Brian, this was my link with New Zealand, was Sir Brian Barratt-Boyes was coming from Green Lane, this is 1969, was coming from Green Lane to do the first valve transplants or valve replacements in England, and the London Hospital was the place that he chose to actually do his demonstration. And so as a consequence of that, we of course had to have an intensive care unit, which we didn't have before this. And so Dr. Franklin Simpson, who was an anaesthetist, actually was designated to set up this unit, which was to be 24-hour care for patients. And so I was part of setting up that as the physiotherapy part of it. And so my sort of experience in intensive care started there, but it was actually very much less than it would have been today, in that we did the breathing exercises and the breathing things, while anaesthetists did the bagging and the hyperinflation. And then we were allowed to do the suction, and we used to do the suction with catheters which were called Franklin Simpson catheters. They were the first catheters that you could actually control with your thumb. Up till that time, all catheters, I think, had just been straightforward suction. And so that was a very interesting part of my sort of student teaching life. And the other part was, which, I mean, you can't imagine it today, but these valve replacements took 8 hours of surgery, and in addition to that, there was the cooling and warming up process. So patients were actually in theatre for nearly 24 hours. The theatre was written off for 24 hours. And because the first patients that they started on were going to die, I mean, they were very much guinea pigs, they all had a lot of heart failure. So, of course, their time on this hard table, they developed these dreadful, almost like frostbite bed sores. I said bed sores, and I seem to have an affinity, on their sacrum. And so as part of my student teaching, I was to do a sort of research project. Now, having had done a lot of research now, and I look back and I think, goodness, how could I have called it research? But what we did was we did take alternate patients, and we gave one would have E2 doses of ultraviolet light to their sacrum. The theory being that if you gave E2 doses, you thickened the skin. I think that was right. This was a long time ago. And so they'd have that for a week before their surgery. And then after their surgery, they would have some more ultraviolet light. I can't quite remember all the doses now. And then we compared those that had it and those that didn't. And in fact, although this wasn't really done statistically, there seemed to be a slight improvement on those that had ultraviolet light to those that didn't. However, we never proceeded with it, and as the surgery got better, so the bed sores improved, and it sort of, but it was an interesting it was a little eye-opener into doing research. And the thing that I learned about it was that you never give your project to someone else to do, because it never gets done quite the same as you would do it. So I got married in the middle of it and was off for 2 weeks. So I think that was all they'd allow me to be off. And the other person mucked up my research, in inverted commas. However, it did help me to pass my exam. So the student teaching, we had exams at the end of it, part of which was this project that we had to hand in and be questioned on, and the other part was actually to teach 2 classes. And one of the classes I taught was electrotherapy, and it was shortwave diathermy. There must have been 2 things, because one was shortwave diathermy to the knee, and the other one was direct current I can't remember to where, but the thing about the direct current was teaching how to fold the pads in 16 thicknesses without any bits showing. And so that was part of my exam, and the other part was to teach a very didactic class in anatomy, and I did psoas major. That was my class, was psoas major. And one of the things that I remember was my supervisor for my electrotherapy teaching was a woman who had been the principal of King's College Physiotherapy School, whose first name was Muriel. I can't remember her second name. But we always called everyone by their surname. You were Miss this, Miss that. There were no Misses. It was all Miss this, Miss that. And after I'd passed my electrotherapy exam, my greatest accolade was when she said, "Please call me Muriel." I thought I'd arrived in the physiotherapy world.